Hello, and welcome back to the Herzog Clinic Minute. October is Breast Cancer Awareness Month, which provides us with a perfect opportunity to discuss women's health. I'm going to take this opportunity to dive deep into some important issues. The U.S. Preventive Services Task Force recommends that women aged 40 to 74 receive a mammogram every 2 years. Many doctors, myself included, recommend yearly mammograms, and women with dense breast tissue may benefit from breast ultrasound. It may be TMI, but I personally have a family history of breast cancer, and like many women have dense tissue, so I opted for a 3D breast ultrasound for extra reassurance. It's just an additional screening tool that we can use, but doesn't take the place of my yearly mammogram. So I do both. At any age, if you feel a lump, even after a recent mammogram, it is important to see your healthcare provider right away. Breast cancer is not exclusive to women, so men should also be aware of the warning signs. Other valuable screenings include DEXA scans for bone health and density. Most women begin these scans at age 65, but those at higher risk, such as smokers, women with a family history of osteoporosis, or those approaching menopause should talk with their doctor about getting screened earlier. You have heard me mention weight-bearing exercise, which is very protective against osteoporosis. Have your doctor check a vitamin D level for you since that pertains to your bone health. Another important topic pertaining to women is PCOS. PCOS is polycystic ovarian syndrome. I generally explain it as a metabolic problem, but also it is a hormonal and reproductive disorder. Women with PCOS may have excessive facial and body hair called hirsutism, weight gain, severe acne, irregular periods, and male pattern hair loss or alopecia. Women may not have those typical features. Sometimes we spot small cysts in the ovaries by ultrasound. If it weren't miserable enough, PCOS is the leading cause of female infertility. If you are concerned about PCOS, then you should mention it at your next visit. Cervical cancer screenings, or pap smears, are generally recommended every 3 years or every 5 years if combined with HPV testing. These typically begin at age 21. If you want to protect yourself or your child from cervical cancer, as we are learning other cancers like HPV-related mouth cancer or throat cancers, then make sure you ask about HPV vaccination like Gardasil. It is approved up until the age of 45. If you haven't noticed, menopause is definitely having an overdue moment. We have learned so much from the Women's Health Initiative, but it did create a fear of cancer among women, which has overshadowed beneficial effects of hormones. The study had many limitations. It studied one type of oral non-bioidentical hormone, and the results were applied to all types of estrogens and routes of administration. We now know that this was a major shortfall. Women deserve more and better research to be done. For example, currently there is one indication for testosterone in women, and should a woman need that prescription, there is no FDA-approved testosterone dose in the US. I think we're up to 4 countries as of this year that do have it. And I don't say all this to create anger, but to educate just how much farther we need to go in women's health. Should you be curious, the condition that merits testosterone in women is hypoactive sexual desire disorder, or low libido. And there are a couple other prescription medications that I can try for that condition, but if I need to treat with testosterone therapy, then I'm forced to prescribe agents intended for men. As you can imagine, we use a much lower dose in women. If my female patient could walk away with one piece of information in regard to menopause, it would be that you don't have to suffer, and different treatment options are available for this normal yet often problematic physiologic change in life. Whether it be frequent urinary tract infections, hot flashes, night sweats, or painful intercourse, your doctor is equipped to help you navigate it. Thanks for joining me for this month's Clinic Minute.